Well, welcome. So we're going to be talking about accessing post-adoption support for folks who've adopted children from foster care. So it is not always straightforward, and it does have a lot of variety as you go across the state, as you go to different counties, and also as you move out of state. So I thought it would be helpful for folks who had been coming to me with lots of questions about post-adoption supports and really just getting some of the basic information out there. It's only going to be an hour or less, so it's really just a quick overview, but hopefully it will give you guys some questions to ask. And as we move forward, it will maybe give you an idea of at least what to pursue. So I'm Sasha McGowan. I am a licensed clinical social worker. I am the director of the FIT therapy program at the Marin Foster Care Association. My private practice is foster parent therapy, so I think you can probably see a theme there. Hopefully the folks that are going to be listening into this on the future, certainly the couple that I've got here in the room, but in the future will be adoptive parents or prospective adoptive parents of children from foster care. I do want to clear the air that this is not going to be the only perspective that is out there. I may have missed some resources, or I may be offering resources that have limited scope, so they might not be applicable to everyone. I did my best to verify all the sources before I put the training together, but I'm only human. So here's hoping, but as we understand, social services is changing all the time. So hopefully this stays relevant for a good amount of time, but it may need to be edited as we get updates from different agencies. So we're going to be talking about a couple different things. We're going to be talking about accessing mental health services, accessing physical and developmental health services, what supports are out there for parents, and also what are additional resources for special populations, including transracial or cross-cultural adoptees. I am going to have a chance to chat with folks who are here with me now at the end of the training, so that if you've got specific questions you'd like to ask, we can ask those off of recording. So there will be a chance to ask questions for sure. So let's talk post-adoption 101. So the very basic first piece of adoption assistance is the Adoption Assistance Program. So the Adoption Assistance Program is a federally funded program that was meant to encourage and support the adoption of children into family settings rather than having children being raised in foster care. All children that are adopted from foster care in California are eligible for the Adoption Assistance Program. This is not the case in every state. Some states do not qualify younger children or children with no special needs for adoption assistance. Here in California, we have interpreted this to mean every child in foster care has this special need. It covers monthly financial assistance through AAP payments. So that is what people are most familiar with, is that after you adopt a child, you continue to receive some financial support for that child. It provides medical coverage through Medi-Cal and out-of-state through Medicaid. And it also provides payment for some very specific specialty services, which we'll talk about in our mental health section. In most cases, benefits are going to continue until the age of 18, but there are special circumstances where they would continue until 21. So in the cases where a child has a disability, or if a child was adopted as a teenager, their adoption assistance may continue until age 21, likewise for children adopted by relatives. Benefits are not limited by state or country of residence. You could move abroad and still receive these benefits. So there's a lot going for the Adoption Assistance Program. So I get a lot of questions about adoption assistance payments because they've got some interesting language around them. They say negotiated rates. Everyone's like, is this an actual negotiation? Do I get to negotiate about this? And the answer is only sort of. So adoption assistance rates are set, but they are set at the same way that a foster care rate is, based on the level of care of children. So you will have a chance when you adopt a child, which my folks in the room know, to state the child's level of care, what their intensity of needs or services are, and a rate will be determined and proposed to you based on the same rates that we use for foster care. So as of July 1st, so just last month, these are the new rates at the different levels of care that went out. So if you haven't seen the update yet, you will. But our basic rate for adoption assistance in California is $1,206. Right. So let's say that some things have changed, and this happens quite often. At any time post-adoption, if you feel like your child has changed their level of care, you can request a new assessment of that child. You would submit a particular form, it's called the AAP3, to the county agency where the adoption was finalized. This is sort of what the form looks like. This is just the first page, but you will be going through and stating in your words what has changed that makes you feel that this child will qualify for a new rate. There are additional forms that they'll respond to you with and walk you through, but the county where you adopted the child is where you start. A lot of times it starts with just a phone call. It is not uncommon for, as a child who is growing, for them to become more complex. So do not be shy about submitting this request if you find that your child's needs are increasing and you could use additional funding to help them and support them. So, what if my child is a regional center child? So, children with pervasive and permanent developmental disabilities are going to be assessed by regional centers for eligibility and access to services, which we will talk about in our developmental section. But if a child is eligible or provisionally eligible, so that means that that child is over the age of 3. This does not count early intervention services for developmental delays for infants and toddlers. You can actually submit that same form to be assessed for a dual agency rate for adoption assistance. So that is sort of an additional level of care beyond that level of care 4. So the regular scale goes from basic rate to level of care 4. If your child has a pervasive permanent disability, there is a different rate that you are eligible for, and that child deserves to have so that you can afford the things to care for them. Dual agency rates are higher than the standard rate, and it's meant, again, to better support these children and keep them in family homes. So don't be shy. That child deserves to have as much as they can have in the world. I've definitely had families use this to buy wheelchair accessible vehicles, to modify their homes to be accessible to children, to send their children to specialty summer camps. Like, there is so much in the world that we can get access to our kids for, but only if we ask for what we need. This is the other thing that I get a lot of questions about, which I think is pretty normal considering I'm a therapist. So people want to know what's out there for mental health resources for adopted children. So children who have been adopted really are often in need of mental health services because it is traumatic to be separated from your families. So regardless of if it was a separation as an infant or a separation as a teenager, there's going to be impacts on our children that we may need to support them. Our children may have suffered abuse or neglect that also create intense needs for specialty mental health services. Behaviors and impacts may come out over time that were not apparent at the time of adoption, but this eligibility does not go away. This stays with them all the way through their childhood. So children who are adopted in California and who receive AAP are eligible for Medi-Cal, and if you move out of state, they're eligible for Medicaid. Gosh, at this point, I want to say there's like only one state that is not participating in Medicaid for adopted children, and they still allow you to apply. You just have to go through an extra process. I want to say it's Wyoming, and I'm sorry if I'm heading libel against Wyoming, if it turns out it's actually a different state that I'm thinking of, but nonetheless. Medi-Cal provides full coverage for mental health services for children. So that means, and this is, by the way, not a comprehensive list. This is just the most commonly used services that I see children who are adopted use. Outpatient mental health services is the most common. Okay, so children in adoptive families who receive AAP and have Medi-Cal have access to individual and family therapy. A lot of the times I see children maintain the same therapist that they saw while they were in foster care, as long as the families aren't moving around too much. There are also behavioral support specialists and interventions, whether that's a therapist, a technician. I've seen it be in-home, school-based. It is incredible, the flexibility of Medi-Cal services that are emerging. In Marin County, a lot of those services are managed directly in-house through the county, but some of them are managed through, for instance, Seneca family of agencies, and certainly there are outpatient mental health being offered through the school districts as well. The other thing that Medi-Cal covers is inpatient mental health. So if we have a child who's having an acute psychiatric crisis, they can be hospitalized. Marin General has a crisis stabilization unit that is wonderfully trained for children. And it also covers residential placement to stabilize from that crisis. So we have children who then go to a hospital placement at an inpatient unit for a significant period of time in order to get them stable and ready to be safe at home. So Medi-Cal is probably the #1 way that children in adoptive families access mental health supports, but it's not the only way that they access it. On top of Medi-Cal, Adoption Assistance provides wraparound services and residential placement services for children. So these are payments that allow access to intensive programs that might otherwise financially be out of reach for adoptive families. So this is a program that I think is picking up speed. I am hearing more and more and more families taking advantage of adoption assistance wraparound programs. Programs are intensive home-based services that are meant to stabilize children in their adoptive homes and prevent children from going to residential out-of-home placement. So if a child is having significant mental and behavioral health challenges, these are services that come into a family's home and serve the entire family system to help support these families. The intent is that it's to build on individual and family strengths and make goals more achievable for those families. There are actually 3 ways. I wrote 2 ways and then added a 3rd one. There are 3 ways that counties provide wraparound services. One is through county mental health treatment teams. So a lot of counties have their own in-house wraparound services, especially bigger counties. And here we are, we're in a tiny one. And contracted providers. So those are specialty mental health providers that work directly with the county. So that here in Marin County, that would be Seneca that provides those wraparound services. And then also private companies. So there are private nonprofit companies that work across the state of California. Some of them have regions, some of them are very flexible, that specifically provide wraparound services for families. One that is doing a lot right now is the Leaf Company, is coming into a lot of Bay Area and Northern California counties and trying to expand the support available for them. So this is the set of options that is really meant for crisis. It's really meant for when a family is telling themselves, I don't know if I can do this anymore. And they come in just enthusiastic, lots of supports, lots of ideas, but it is a commitment. It's energy, right? It takes energy to participate in these services, to make the space for these services in your family, in your home. So it is not a Band-Aid. It is meant to really do a ton of change for families. So I never want to imply that it's easy to participate in these programs. I think it's supportive, it's helpful. I've had post-adoption wraparound services in my home for my kids, and it was incredibly supportive and helpful, and it was work. These services go for up to 18 months, and again, should be used in times of crisis. And here is the final and most serious thing that adoption assistance will pay for, and that is temporary out-of-home placement. So when a child has incredibly severe mental health or behavioral health needs, in limited circumstances, they can benefit from placement in specialized residential mental health treatment programs. This is meant to be a last resort. This is meant to be incredibly time limited, again, a maximum of 18 months. And I like to make sure that families really consider every option before considering residential, because the loss of being sent away, that rejection of being sent away, is hard to undo. It makes a big impact on a child. I also like to just reiterate to folks that once adopted, your child is as if they were born to you. Your responsibilities for that child are as if you gave birth to them. So you will be responsible for identifying the residential facility, participating in the intake process, reaching out to the county of adoption, so where your adoption was finalized, to discuss the payments. In California, facilities cannot be paid more than the standard rate for residential care. So for the same residential cares that our kids in foster care might go to. So you must consult with the county of adoption if you're considering residential placement. It can be incredibly costly, and those costs are ultimately the responsibility of the placing family. So we really want to make sure that if this is something you're considering, that you get support and guidance the whole way through. Here in Marin County, we have a post-adoption support social worker that works at the County of Marin, and she would be your first stop for that conversation here in Marin. One of the other ways of funding therapy for children is victims of crime funding. There is also sometimes, it's called CHAT funding, which is child abuse therapy treatment programs. Some children in foster care may be found eligible for this particular kind of funding. In California, this is administered by the California Victims Compensation Board. There's a contact person for each county. If you go to the CalVCB website, there's a list of them. And the most common use of these funds is to provide specialty therapy. So this offers just a wider range of opportunities to find a specialty therapist or someone who's outside of the Medi-Cal network. Because Medi-Cal offered therapy sometimes is limited in certain areas, or it has more rigidity than a child needs. I've had victims of crime funding pay for equine supported therapy, so horse therapy. I've had it pay for a therapeutic intervention camp for a child. It just has more flexibility than some of the other programming. If you're receiving child abuse treatment therapy funds, that is usually administered through the Office of Victim Services, and it comes from a very similar route. Here in Marin County, that goes through the Jeanette Prandy Center in San Rafael. And we've got us. So the Marin Foster Care Association's FIT program can also support parents, adopted children, and biological children. So I, at the moment, am primarily seeing parents, but that doesn't mean that that's all I see. I also do see children. The only children we don't see are children who are currently in foster care, because their confidentiality and their privacy is so important that we want to make sure that they are going to see the clinicians who can best support them, and that's usually through Medi-Cal. But for children who are adopted, biological children and families, we're trying to make sure that every family gets as much support as they can get. So we are a resource here in Marin. One of the other things that we do is navigation. So if you're having trouble finding exactly what you or your children need, if you reach out to us, myself and our associate therapist, Lena or Cindy, will help find where you go next. So I do lots of things. So give us a shout if you need us. And again, at the end, I will have plenty of time for specific questions or scenarios if people have specific questions too. So moving on to physical and developmental health resources, I really just want to emphasize that we don't always know everything about our children when we adopt them. And certainly a child can have physical or medical special needs that come up later or that we're aware of but aren't sure what's covered. I really want to emphasize that California Children's Services is amazing. So it is a state program that enhances the coverage of Medi-Cal for low-income families. But adopted children who were eligible for CCS, that's what California Children's Services, we call it CCS, prior to adoption, will continue to be eligible regardless of income. So if you're caring for a child that has sickle cell, or you're caring for a child that was born with a club foot and needs orthopedics, if you're caring for a child that needs a breathing machine, all of that continues to be covered post-adoption, regardless of your own personal income. The covered specialty medical care is invaluable through this program. I've had children go all over California to get specialty care, to get special diagnostics, to receive extensive medical equipment that they needed, whether temporary or permanent. And here in Marin County, there is a public health nurse who works at Marin Community Clinics who will help you if you have a child who's eligible for CCS. So not only do they receive the support, they also have case management that goes along with it. So if you have a child with medical needs, adoption is not a barrier for them. Now, let's go back to the regional center. Let's talk about what if developmental concerns come up in the future. Because, some folks are adopting infants or toddlers who we might not know what the future looks like for them. They're still growing and learning and developing, and we're just going to have to wait and see. All children in California have access to assessment by the regional center for free, no charge. The diagnosis and eligibility assessments are available to any child. Infants and toddlers who are under 3 can be assessed and treated for developmental delays. That's those early intervention services that I mentioned. Those are meant to be temporary. They are meant to help children catch up. And they are also meant to be early identification for children who may have long-term developmental disabilities. Once a child reaches the age of 3, they can be assessed and diagnosed for permanent developmental disabilities. They might be eligible for lifelong services with the regional center. The criteria for it are pretty intense, but the main characteristic is that it has to cause a significant functional impairment. So you can have a disability without being significantly impaired. So again, this process can be a long one, but there are also advocates that work with the regional center as well. Adoption is not a barrier to lifelong support from the regional center. You are not taking their qualification away from them when you adopt them. So what happens if I move to another state? Because California sounds pretty great, right? California sounds like it has a ton of supports for kids, which is 100% true. California does an exceptional job, especially with children with disabilities. I'm going to encourage you, first of all, that if you are considering moving out of state and you have a child who has special needs, to please, please, please look up what those states provide for children with special needs, because California is the exception, not the rule. For every other situation, there's a solution for that. So ICMA is the Interstate Compact for Medicaid coverage. Is an agreement that was formed between participating states to allow for Medicaid coverage of children adopted from foster care. So this means that they have an agreement across these states that if that child was eligible in the state that they were adopted, they will be eligible in the state that they are living now. So that means that if I took a child to Texas and I moved to Texas, if they had Medicaid, which is called Medi-Cal here, they can get it in Texas, regardless of whether Texas would have given it to them. Okay, so that's the agreement that these states have made. There used to be 2 holdout states. I want to say it was Missouri and Wyoming. I think Missouri signed up. Good job, Missouri. So Wyoming, you can still apply for Medicaid. You just have to go through a separate process. And it's not guaranteed the way that this compact guarantees it in other states. So you are not stuck in California forever, though honestly, California is pretty great. So if you can stay, you should. So let's talk about support for parents. So the support for the kids is great, but you are part of this family too. And you need to be able to function in order for your family to function as well. So there are several different ways that you can get support as a parent. The number one way, and I always put this as number one, is you're supporting each other, right? Where adoptive families come together and support each other through a process that is unique in the world. It's very different from parenting other ways. So especially those who are adopting from foster care. So the best way to do this is through support groups, agencies, gatherings, things like the Marin Foster Care Association. So come to our Coffee and Connects, come to our support groups, reach out to our programs, ask for help when you need it. Because just because this child is adopted does not mean that they stop mattering to us, because we want, you guys matter and we want to support you. We also can seek out professional support. Finding a therapist for yourself, right? Again, our program here at MFCA does offer therapy for parents, and I can help you find a therapist yourself. So if you felt more comfortable with an outside therapist, I can also help you find one of those. Another thing is a facilitated support group. So here at Marin Foster Care Association, I facilitate a support group on Tuesdays, and that is certainly one way to get support. And then also bringing the support for your kids into your household. So rather than your child just going to therapy by themselves, having a family-based therapy, having wraparound services in your home, anything that includes your whole household. Children are part of family systems, and it's really important that that support extend to you as well. So like I mentioned, here at the MFCA, we have a support group every week on Tuesday nights at 7. Adoptive families are welcome and encouraged to attend. I actually love being able to talk to our adoptive families. So it is not just active foster families that come, it is everyone that comes. I also just wanted to point out that here in the Bay Area, they're located over in Emeryville across the bridge. We have a PACT Adoption Alliance, and they have some specialty support groups. So adoptive parents of color, transracial adoptive parents of teens and young adults, and LGBTQ adoptive parents. They have regular groups that run, and I've heard nothing but amazing things about all of them. So again, if any of those groups apply to you, I would really encourage you to reach out to PACT. One of the other ways that we can get support is by continuing to educate ourselves about trauma, about loss, about parenting children who have special needs or exposures to violence or exposures to substance use. And really taking in all of the work of all of these professionals. The Center for Adoption Support and Education, which is called CASE, has extensive webinars and trainings that are focused specifically on adoptive families. The webinar is usually $5 or $10. You can actually get coupons, but if you email them, they'll just give you a free access if money is a limiter. But again, they use the money to support a ton of amazing projects for foster and adoptive families. Also, here in the Bay Area, we have Chabot and Las Positas colleges that provide training for foster and adoptive parents, for professionals, for everybody. And they're funded through the counties and through federal dollars. And you are welcome to participate in any of those trainings, and they're wonderful. We also have trainings here, like the one you're just listening to right now. So we try and be pretty well-rounded. So let's talk about some special populations, because there's some things that are out there for kids. One of the other things that PACT Adoption Alliance does is that they have the Center for Race and Adoption Focused Therapy. So this is a therapy center for in-person and on Zoom that is targeted specifically on adopted youth of color and their families. Many of those families are transracially adoptive families where the parents are white. I could not be happier that this exists, because it's very, very needed in the world. So the idea is that this is high quality adoption sensitive therapy services for these kids. The current program serves youth of color who've been adopted or in foster kinship placements. And they also offer family therapy, which I think is really, really important and is much harder to find. So we love that for them. And I would strongly encourage anyone whose children fit the bill to reach out to them. They have a sliding scale that they use that's very generous. And I'm just going to talk about PACT forever. Apparently I love them. PACT also has a family camp, which runs every summer in California, that is aimed at families with adopted children of color. So they come together for 5 days. The children get to enjoy like summer camp programming with other children who are adopted, while their parents are doing adult workshops, groups, education. I can personally vouch for this. My family and I have gone for the last 2 years with our 13-year-old, 11-year-old, and 2-year-old. And it was an incredible time every time. And it's the only thing my kids enjoy doing summer camp wise. So they could skip every other summer camp and they'd be happy, but they never want to skip this one. So strongly encourage any family that's adopting cross-culturally and is adopting children of color to consider joining something like this, where your kids can see kids that reflect them and have similar experiences to them. There's also the All Children, All Families program through the Human Rights Campaign. So this is a a training and support resource for LGBTQ foster and adoptive families, and also families caring for LGBTQ children. It has a list of agencies all across the United States that have met their standards for inclusivity. So if you are a family who is LGBT, or you have children who are LGBT and you want to know, will these agencies support them and me? You can look for them on the list at the Human Rights Campaign All Children, All Families program. So what I'm going to do is I'm going to say thank you, and I'm going to end our recording for folks, and we can then listen to what those folks I have in the room have to say. And I just really appreciate you listening to me talk nonstop for 40 plus straight minutes. So thanks.